Let's talk about something that most child and family therapists quietly recognize, but they don't often say out loud. There's a point when Uno stops being a tool, and sometimes it starts to become the only tool that the therapist has. You know what I'm talking about. The therapist who pulls out the Uno card at intake to help establish therapeutic rapport. Uno in session 2. Uno when the child is dysregulated. Uno when the child is stable. Uno when the parent wants to process trauma. Uno again because it worked last time. Uno when you're doing supervised visitation. At some point, it's not even a choice. It's just the default setting. We're going to play Uno today. Let's start with Uno. Maybe we can talk after Uno. Actually, let's just do one more game. Now, to be fair, Uno is a great engagement tool. It does build therapeutic rapport, it lowers anxiety, and it gives structure to relational interactions. But when it becomes the only consistent intervention, something else starts to happen clinically. Avoidance gets reinforced instead of gently expanded. Emotional content tends to get delayed indefinitely. Verbal processing never quite gets off the ground, and maybe next session becomes a long-term treatment plan. In the most honest part, sometimes it's not even about the child anymore. It's about the therapist's comfort with structure, predictability, and not having to sit in the harder clinical moments. Because Uno is very easy to start. Uno is predictable. Uno has rules. Uno doesn't require sitting in silence when the child says, I don't know. But therapy can't stay with Uno forever. At some point, the work has to move beyond playing side by side. At some point, it has to go into meaning making, into emotional processing, and relational work. Because if every session has you pulling out these Uno cards, then the question eventually becomes, what is being avoided by staying in the game? Uno should open the door, but it should not become the room of your therapist area. Play is powerful, but even play therapy has to eventually move toward depth and emotional processing and not just in repetition.